I have done with some major areas of cough. Now I'm coming to productive cough. This is some alarming areas. So look for underlying cause of this productive cough. Is the patient having any infection? Is the patient is having any smoking history or COPD or other airway disease, particularly bronchiectasis? Now, COPD with cough, as I have said, there is a, now they just nomenclature is like COPD, asthma, overlap disease. So treatment is a bit different from the typical COPD. I've dealt with infection, I've dealt with smoking and other airway disease, particularly bronchiectasis. Here, the history is very important. Whether the patient is coughing up copious volume of sputum, which is mucky in consistency, whether there is any history of hemoptysis. Not always they have the history of this hemoptysis. After COVID, we are seeing quite a few cases of bronchiectasis, particularly patients who were admitted in the ITU. They are developing either interstitial lung disease or bronchiectasis. Some of them definitely not developing any sequelae. So they're lucky, but be careful about them. Management, optimize airway clearance. So optimize airway clearance, with that word, I mean, definitely you have to use some mucolytic, you have to use some steam to clear the airway. Gargle does not help these patients that much. If they have complaint of sore throat, that is usually points out to acute infection, not the chronic cough. So gargle, you might not recommend in this kind of condition. Treat infection. If you have just a definite evidence like the CRP is high, or there's sign in the X-ray, or the sputum test is showing something, it would be good. At least that will guide you that what kind of antibiotic would be the best for the patient. Sometimes, particularly in case of this bronchiectasis or chronic cough, say azithromycin, low dose, sorry, it's not 3 times, 1 time a day. So you can continuously use to help the patient with this chronic cough. Physiotherapy, chest physio, even you can teach the family that after steam inhalation, you just bang on the back so the patient can benefit from this physiotherapy, a daily one. They cannot afford regular physiotherapy for chest physiotherapy for chronic cough, but you can teach the family how to do it.